Hello everybody, welcome to my channel. My name is Jordy. I'm here to do a case study review. I'm a student right now studying traditional Chinese medicine and acupuncture in Nova Scotia. And as part of the curriculum, we go through 2 full years of study and classwork, and then in the third year we do a full year of clinical hours where we are getting lines filled out for paid patients and for free treatments and marketing hours and you name it, point location, diagnosis, and all of that. So we're marked on many different areas of the practice and experience of an acupuncturist and traditional Chinese medicine practitioner. And what we do is in student clinic is we've got students as well as people from the public coming in and seeking affordable treatments. So we only charge a fraction of the cost for the price of one treatment, and the treatment's a little bit longer than what a typical appointment would be, because each of the appointments include an initial welcoming at the front desk where you check them in, and if it's their first time you get them to fill out a waiver and a contact info form, and then you take them into your little cubicle space and start taking notes and asking questions about how they're doing, how's their week going, how's the last couple months been, and we go through a list of questions doing this initial first intake. So we have these forms that guide us through which questions we should be asking, and it's definitely just a bare bones minimum. Like, you want to get really creative and exact with your questions. As part of being a practitioner, you have to really be able to observe and listen to how the person is looking, sounding, talking, any mannerisms, or as well as just listening to what they're actually saying and making sure you don't make any assumptions along the way. So the first case study that I have today, this is what, I won't show you what the form looks like because it's got personal information on it, just on my tablet here. But typically you'd have at the top of the form name, date, practitioner name, patient's name, and when their last visit was. So we would have the chief complaint. Usually this is what brings the person into the clinic. Sometimes they don't know exactly why they're coming, so you have to kind of just go through everything with them and come up with a focus for the treatment. But the female that I was treating today came in for an extreme case of insomnia. And well, I would say an acute case of insomnia. This is something they've been struggling with for quite a long time. But they also it had gotten worse in the last week or two. Oftentimes patients only really discover acupuncture and Chinese medicine when they're in a health crisis of some sort. She also wanted to see if we could address any of the pain in her right foot from plantar fasciitis. So with the initial intake, we gather all the information, which I'm going to run through with you and kind of build a picture, build an idea of what we're dealing with symptoms. And then we'll talk about what the tongue and the pulses looked like and felt like. We'll tie it all together and talk about the diagnosis and the treatment plan, which was reviewed by a supervisor and signed off on. So it has been approved. Typically, you start asking questions about what their chief complaint is all about first, and then you can branch off into the standard questions just to fill in the gaps of the bigger picture of the overall health that they're experiencing, their constitution, their current state versus where they were a couple months ago or years ago. So as a picture of her insomnia, first of all, she's a very busy mother of teens, late teens, teenagers, and runs a business, gets to work from home a lot of the time, and has a partner who also works with them. But anyway, this person's problem with sleeping is in a couple different areas. First of all, they're overthinking. They have trouble falling asleep. So when we're asking about sleep in a consultation, we're looking at three main questions. How are they getting to sleep? Are they staying asleep? And what's the quality of their sleep? What's it look like throughout the night? So, she's definitely overthinking, watching TV, winding down around 10 o'clock and going into bedroom, but then watching TV or reading books. And just as she starts to wind down for bed, her teenagers come in and want to decompress and talk about their day. And this oftentimes can go from 11 till 1:30 a.m. at night. So this is really throwing off her winding down process. And we talked about how maybe a healthy boundary may need to be established in order for these treatments to even have the opportunity to work for her. She'll have to make the effort on her end for that. When it comes to staying asleep, lately, she has no problem staying asleep unless she gets disturbed by her cats. But she's falling asleep around 1:30 a.m. every night and waking up around 8 a.m. in the morning. Now that's a standard sleep cycle for her that's been happening for a couple of years now. But in the last week or two, she's been staying up until the crack of dawn, 6 to 7 a.m. in the morning, and then sleeping in till about 11 to 12 p.m. So she's really only getting a disjointed, 4 hours of sleep, maybe 6 hours of sleep. So not ideal. She is a deep sleeper. So we're looking more so at overthinking being the cause of the insomnia, and with it being so disjointed that she's not getting any sleep during the yin time. We're looking at a yin deficiency that's kind of hinting from that sleep pattern as well. And a blood deficiency is also what we're picking up on from some of the other notes, and I'll explain that. Okay, as well as with her plantar fasciitis, we'll just skip over to that and then kind of get back to the insomnia. It's in the inner step of the right heel. It's better for movement and flared up last month. This is something that TCM can try to help alleviate. We picked a couple of isolated points for that, but we're mainly focusing on the insomnia, as it seems like it's throwing off her whole balance, her ability to work, her ability to be energized and able to restore herself throughout the day. Looking at other questions, she prefers a cold room with a headache. She does get headaches in the last week. They're in the temples, usually from lack of sleep. There's a history of migraines in the temples and forehead, which are better for pressure and better for the dark. However, the migraines have gone away, mostly, she said, since starting her estrogen and progesterone hormones, which started back in the wintertime in February, I believe. She was really struggling with insomnia at that point as well, and there were some stressful situations happening in the family. So the combination of that, she decided to go on hormones like her doctor suggested to help combat the menopause changes, where she's a 52-year-old woman. And this has improved her sleep but not fixed it. There's still some lifestyle changes that have to be made. She also has a underactive thyroid, which she's taking medication for. She experiences a lot of brain fog. She also is being treated for anxiety with an anxiety medication. And we asked her about joint pain. She doesn't have any joint pain. She doesn't have any hearing issues or ear issues as well. When it comes to her lungs and sinuses, they're just, getting runny nose allergies, light allergies. But she does take a allergy pill every day just so she doesn't have to deal with it. Sometimes her eyes get itchy. But she doesn't experience floaters. It's mainly just itchy from the allergies. With the skin issues, sometimes she gets the odd piece of acne on her chin or some on her back, but it's very random. The other main issue, though, we discovered through the consultation form was that she's got a low appetite and she's only eating one main meal a day at supper time, a late supper, and sometimes some snacks into the evening, maybe some snacks before supper, but not mainly just the main meal, and some coffee throughout the morning. This has been a long-standing cycle for her eating habits, likely due to the fact that her sleeping schedule has been off for a while, and also, aiming to lose a little bit of weight. A lot of people are following the intermittent fasting trend, and this is something that she's partaking in, which does help people in some ways, but according to Chinese medicine, we more so lean towards having 3 balanced meals a day with snacks, to keep that spleen energy flowing. In the last day or two before coming here, she did have hypochondrial pain along her ribs, which she said felt like the oncoming of a gallbladder attack. Her gallbladder was removed earlier in the year, in the new year. So this the sensation of a gallbladder attack may have been a flare-up of what we would see as being a cause of a gallbladder attack, but no gallbladder to be there. So that's not a good sign. The hypochondrial pain, that was a concern. It comes across as being aching, and when it comes to her bowel movements and digestion, she didn't have any complaints for digestion. Coffee helps with the bowel movements every day. Sometimes they can be loose, particularly in the last week. Sometimes some constipation. Another sign that the sleeping has been disrupted, I just noticed from one of my notes, is that the air conditioner in her room broke when this new cycle of worse sleep has started happening. Waking up at 6 a.m. and going to sleep at 6 a.m., waking up at 12 p.m. So, just a slight temperature decrease can really cause a big effect, and that further indicates that perhaps there's a yin deficiency, affecting her sleep. Her urination is regular, no history of UTIs, and her energy levels are not great, but she did mention she's got a lot of willpower and determination to succeed and to keep the house running and the business running. So she's, keyword, using a lot of willpower and determination, which is kidney energy, kidney chi. So she's definitely relying on her on her prenatal chi right now. She's not, obviously, with her spleen chi not only having one meal a day, it's not building enough blood, building enough essential substances like chi and blood. And so we're seeing obvious signs even before seeing the tongue impulses and a lifestyle trend of blood and chi deficiency. And what we're seeing here as well is that with the air conditioning being a hint that the heat is an issue for her when she's sleeping, as well as, not getting any sleep during the yin time at this time, in combination with the overthinking. So we're seeing signs of some yin deficiency, especially where she's on hormones for estrogen and progesterone. That that is also a sign that she's kidney yin deficient. Being menopausal. Um, As far as emotional disposition, I asked her what kind of feelings she has on a regular basis, and she described almost all the feelings that we asked for, like frustration, sadness, worrying, particularly anxiety. So she's constantly counseling herself in her head and needs to do things like staying busy or reading to keep the mind calm. Um, Even though she has that brain fog, um, there's still that undercurrent of worrying. Um, I'm thinking the brain fog that she's describing is perhaps short term memory loss, although I didn't really get into the specifics with her, which can be an indication of blood deficiency as well. So this is when it got interesting. This is when it got a little bit um, concerning, actually, because when we checked out her tongue, immediately you can see that it's like a wine colored purple. Um, it was wet, and it also was stiff, so kind of pointed and round shaped, and no quivers, just stiff, and it was slightly deviated to the right side. After being out of the tongue sticking out for a couple seconds, it did relax, and then it kind of deflated, and you could see the scallops, you could see the red sides. You could also see tremors in the tongue, tremors that went from left to right instead of just like outside quivers or internal quivers on the inside of the tongue. They were like waves rolling across the tongue, um, like vertical lines from top to bottom. So this is a sign of liver wind, as well as chi and blood stagnation. The chi stagnation being the red sides, and the blood stagnation being the purple color of the tongue. Of course, this would be because of the chi and blood deficiency, which we're obviously seeing here. But since the chi and blood deficiency is so strong, being the main part of the diagnosis so far, the deficiency is leading to the stagnation because your spleen is not making enough chi and blood. And the tremors is a sign of internal wind, which indicates that we're not only looking at a kidney yin deficiency, but also a liver wind deficiency. Which is what happens when you have a severe case of chi stagnation caused by the deficiency. If we looked at her when we looked at her pulses on the left side, top, the heart position, it was tight, not wiry, not like shaped like a cord or anything, but just tight and hitting the top very strong. Not choppy, but definitely felt like hitting the top of the drum. So the heart is working overtime with not enough blood is what that means. And there's also stagnation in the pectoral area. The liver pulse was obviously short, just not reaching the full amount of the box in the pulse position. Short indicates blood deficiency, excuse me, as well as chi deficiency, I believe. Although I assume it's just mostly blood deficiency. Whereas the liver gets its chi from the spleen, so that's why we would look at that more as a blood deficiency sign. The kidney pulse on the left side, which is sometimes considered the kidney yang side, because it's with the heart and liver, which are more yang organs, was small and knotted. So that was interesting because obviously kidney yang is not able to, it's stagnated, that means it's stagnated when it's small and knotted. Um, I don't know too much about what that means when kidney is stagnated. I have to say, I'm still a student. But to me, it meant that the lower jiao was also stagnated just as much as the upper jiao, and the middle jiao was obviously stagnated because of the liver qi stagnation we saw on the tongue. So um, overall, I would say it's just an indication of like a full body stagnation. Um, the kidney qi could be knotted as well, simply because it's strained. Could be an indication of the kidney qi instead of just the kidney yang itself. And that could be her holding on to the willpower, onto the determination, kind of gripping on to the kidney qi and holding it in place and forcing it to do its will. I actually believe that is why the qi was knotted, emotionally anyway. Now, on the right side, on the right wrist, where the lung, spleen, and kidney positions are, all of them were empty. I went from all three levels, and they were all, even at the deepest level, empty. Now, the right side, the lung and the spleen deal with qi, and the kidney yin on that side is obviously empty as well. So we're looking at an overall picture. Just as a recap, we have the stagnation in the purple color of the tongue. We have the liver wind caused by the deviation and the tremors in the tongue. We've got a short pulse indicating blood deficiency in the liver position. We have a tight pulse indicating the overworking of the heart, most likely due to a blood deficiency. We have the kidney qi being knotted in the yang position. The yang being the energy that gets us out of bed. And that is being abused, is what I'm thinking, or what I'm seeing here. She's got all the feelings, all of her organs are taxed. So frustration, sadness, worrying, anxiety. It's just a cycle of all the organs being out of, starved of qi and blood, and all of the essence and qi from the kidney being used for day-to-day function instead of being used to feed the organs as much as well. I mean, obviously the kidney's going to prioritize feeding the organs, but a lot of that energy is being used emotionally, being used to think, where kidney qi is not really meant to be used to think, That's what the spleen qi energy is for. That's what the heart qi is for. We saw how the spleen qi deficiency obviously is in her appetite and her eating habits, which progressed into an even deeper problem of qi and blood deficiency. We're looking at an issue of the essential substances at this point. It's not just one organ that's under functioning or over functioning. So it's more of a systemic problem, like an overall problem. I guess I should try to word it that way, instead of it being a more isolated problem or a relationship between one or two or three organs. It's a very interesting case. And it'll be interesting to see, after coming up with this diagnosis and doing a treatment plan, next time this patient comes in, a change in the pulses, a change in the tongue, perhaps hearing that she's gotten a couple nights of more regulated sleep. And we'll be able to peel back layers, like perhaps maybe, hopefully, the liver wind will have subsided just a little bit. Maybe back down just to qi stagnation at that point, and we'll be able to take a layer off with each visit, and hopefully get things back down to. I don't think we can restore her to full health without her having a complete lifestyle change, but we can definitely redirect qi and blood and encourage the organs to be more balanced. And by her getting some results from these treatments, it'll be more encouraging for her to eat more than just one meal a day and to have boundaries when it comes to, nighttime conversations. Sorry for the phone call, folks. I'm just going to quickly send a message. Okay, well, I'm really happy with how this video is going so far. For the treatment plan, we're not going to do any strong qi movement points because there's no qi to move. There's hardly any blood to move. That would just exhaust the system even more. We're looking at mainly all tonification points with just one, or we had 2 points where we reduced with a reducing action. We reduced liver 2, which is specifically for the liver wind and liver yin. We also reduced bladder 62 on the outside underneath the ankle to help with the plantar fasciitis. It's opposite of kidney 6, which is another great point for kidney yin. So we tonified kidney 6, and we're hoping that those 2 points together will help lift the arch of the heel a little bit more for the plantar fasciitis. But mainly the points here are to bring some yin into the kidneys, some yin into the liver, to boost, car boost, basically boost the battery of the spleen, and dig into the deeper resources of blood to bring it up to the organs so that they can start functioning better, and then making more blood from their day-to-day routine. I started off by reducing liver 2 and reducing the bladder 62. Then I moved into tonifying the kidney points, which was kidney 2, to deal with the false heat and to tonify yin. Kidney 6 to tonify yin. And kidney 10, which is the He of the kidney meridian, which also can help tonify yin and qi. We moved next to the liver points, so we tonified liver 8, we tonified liver 13. Liver 8 is the He of the liver meridian, so it gathers, it's the point where qi and blood gather. It's the point where essential the He points are, they deal with fluid. They deal with the fluid of that organ in that meridian. And the fluid of the liver is blood, whereas the fluid of the spleen would be body fluid. So, the He of the spleen 9, is used to reduce dampness and excess body fluid in the body, whereas the He in the liver meridian is used to gather and tonify blood back into the liver, so that it can be stored there, so that they can have more rest and recuperation throughout the night, and so that the heart can have more blood sent to it as well. So key point, liver 8 there, and liver 13 is on the rib cage. It's the front move of the spleen, so it's right actually where the spleen is, on one side at least. You do both sides because the meridian runs bilaterally. And this will tonify the organ itself. We didn't choose points like spleen 3 or stomach 36 because they deal more with qi and yang, and where she's got she's needing more yin, she's needing more blood to work with here. We didn't want to add more qi and more yang to her situation because then she won't get the sleep that she needs, and then none of this treatment plan will really work. So we're heading towards more of the blood and yin tonics today to just get that sleep routine a chance to start back up again. Then we can do more of the chi tonics as we progress with the treatment plans. So we chose spleen 4 as a spleen point, the low connecting point of the spleen, which connects the stomach and the spleen together. It also is a low connecting point, so that means it connects with the PC6, which is a special pairing that activates and controls the Chong, which is a deeper vessel within the body, a deeper system of blood. So we can kind of tap into that resource and bring it up to the organs by using PC6 and spleen 4. And then PC6 also calms down the spirit and soothes emotions and feelings. So that was also another good point for that. We use spleen 6 because it's the 3 yin meeting point, just above the inner ankle. Spleen 6 is essential for most treatments. Giving yin to the liver, giving yin to the spleen, giving yin to the kidney. We also chose lung 9 so we can get some yin into the lung meridian. We chose heart 6 so we could get some yin and clear some false heat in the heart. And we chose heart 3 which is the He point of the heart meridian at the elbow. He's again deal with the fluid of that meridian. So it's where fluid and chi and all that pools. So this is the fluid of the heart is blood. So this is a great way for gathering and tonifying blood. Heart 6 is the yin. It's called yin cleft, I believe, or something like that. But I believe it's the chi cleft of the meridian. I'm not sure. I'll have to double check that and get back to you in another video. Actually, I can look it up right now. I'm not sure if it's the chi cleft or not. I think it is. It is the chi cleft point of the heart. It's called the yin cleft. This regulates heart blood, moderates acute conditions, clears deficiency fire. It's a great point for heart yin. And we also chose Shen Men in the ear as ear needle, just up here. So it's overall it's a very nice treatment. We're aiming just to get her back on our sleeping schedule, and as the treatments progress, we'll move more into chi moving and chi building. Once her body is actually starting to make these essential substances again. Okay, well that's what I've got for the first video, folks. Really cool case, eh? Oftentimes you see spleen chi deficiency, you see blood deficiency. Sometimes oftentimes you see kidney yin deficiency, but to see such a strong picture of chi and blood deficiency, and to see the kidneys like knotted, which is interesting, in the yang position, and to see the tremoring and the deviated tongue with the liver wind. Obviously, this is a good time for this patient to come in and get a treatment, because it's kind of getting into the more serious territory for worse health symptoms to arise. That liver wind could cause a stroke. The heart could be at risk as well. So it's crucial. It's critical. All right. Well, if you have any questions about this case, don't hesitate to write a comment below, and I'd love to hear from you. Check out my Pisces River Tarot channel if you want to see some of the more spiritual side to what I offer. I offer general free readings. It's whatever comes up in the cards is what I talk about that day. It's not predetermined or anything. So it's just kind of a random flow, and whatever comes up, it may be applicable to your story, it may not be. If you like to book a personal tarot card reading with me, I do offer those over on my other channel as well. As far as being an acupuncturist, I'm still a student, so I can't, book you in for treatment or anything like that. But you can, if you're living in my hometown in Halifax, Nova Scotia, you can book in with me at the student clinic. So easy to find online. And I'd love to connect with you. All right, take care, and I'll see you again soon.